episode, we're exploring why healthcare innovation often struggles to scale despite unprecedented advances in technology, data, and digital health. To help us unpack this topic, I'm joined by Brian O'Connor, Chair of Global Health Connector and a longtime health systems leader working across policy, innovation, and healthcare delivery. Welcome, everybody. I'm Demi Radeva, and this is the Akros Advantage. In this episode, we're exploring why healthcare innovation often struggles to scale despite unprecedented advances in technology, data, and digital health. To help us unpack this topic, I'm joined by Brian O'Connor with the Global Health Connector and a longtime health system leader working across policy, innovation, and healthcare delivery. Through his work connecting governments, health systems, researchers, innovators, and industry leaders around the world, Brian has developed a unique perspective on what it takes to move healthcare innovation from discussion to implementation. Welcome, Brian.
Thank you.
I would love for you to share more about your experience and background and how did you land in the role that you're in?
Because I founded the company, Global Health Connector, about 15 years ago. And the one thing I'd learned in all the various healthcare ventures I'd created in Hong Kong and Ireland and UK and other places was that there's too many silos. People who should know each other don't know each other. They may know of each other. And there's so many parts of healthcare is huge, as you know. And so I decided to do something about it. So we set up what has now become the Global Health Connector. The key to it is to try, you cannot make things happen unless you get everybody involved. Getting everybody involved complicates matters, but if you don't do that, you never connect the dots. You cannot then transform lives. So I started out in this venture thinking, there are times I thought, why did I start this? Because you get people who are saying, well, we are the world. No, you're not. You're a health system in one country. We are the National Health Service or we're of some country. But I gradually, over a period, worked out that there are good people. If you unearth them, if you take away all the debris, you find treasure. And you need some doers who will work with you. And we've now got 90 plus ecosystems around the world. These are permanent multi-stakeholder gatherings who bring in each of their countries every aspect of healthcare. We therefore have an intelligence network that no one else has. We have an implementation network of that scale no one else has. During COVID, we expanded it from Europe into Africa, India, Australia, New Zealand, across in North America, US and Canada, and we're just about to start in Latin America. So it's fun.
Tell me about how you scaled your model. You just talked about the expansion to Africa and India. How did you design the foundation to make it scalable?
I would love to say yes. I sat and wrote out these plans and designed things. The answer is I do a lot of things on instinct. But it's instinct, if you like, informed by experience. I mean, I've been doing this for many years. I've been doing this just nearly 50 years. And I sort of thought to myself, some things are obvious to some people, not to everyone. The obvious is never really obvious. And common sense is definitely not common. So what I decided, the way to handle things is not to write learned papers, though some people like doing that. I don't. Talking about things is important. But unfortunately, many people do nothing else but talk about or complain about something. I decided to do it a different way. That was, I needed success stories. So I first went to one part of the UK, Manchester, to a university which had, in those days, 15 years ago, a digital health division. And I went, wow. Because in those days, that was unusual. And I said, so what do the local health people think? And they said, we have no idea. I said, why? Well, we don't talk to them. Why don't you talk to them? I mean, this is the basic conversations. They didn't know the people who delivered the healthcare in all the NHS hospitals. So I said, we're going to change that. So I invited the chief executives of each of those hospitals to come to one meeting, which we chaired as the Global Health Connector, with the university. And what else do we need? We need private companies, invited private companies in. So we gradually built the ecosystem, not in the sense we had a plan, but it was pretty obvious. If you don't get everybody in the room, you don't get any progress. So that became the model, still exists today, 15 years old now. And it has actually been the model we've used in the other 89 ecosystems around the world. As far as expanding internationally, we had no choice. When you're sitting at home, when COVID, you're told you're not allowed to travel. I remember my wife said, what are you going to do now, Brian? I'm going to have a phone call, a Zoom call. I called friends of mine in the US, a guy called Dr. Joe Cavadar in Partners Healthcare in Massachusetts. I called the guy called Jean Philbert in Kigali in Rwanda, called people in different countries and said, would you like to have a chat? And I said, I want you to introduce yourselves, just didn't know each other. I was the only one on the call that had met everyone. So we took the role of connector. When they finished after 28 minutes, introducing themselves, a total of them, they said, "What should we? That's just brilliant, Bran." I said, "Why is it brilliant?" "But I know it now. I know somebody in Africa or India." I said, "Okay, but so what? What do we do next?" They went, "Have another meeting." I said, "No, you can have another meeting. I'm not going to it." Because again, we're going to be collaborating on the basis. Collaboration means you meet regularly, talk about the same things to the same people, and you never make a decision other than to meet again and do the same thing. Mm-hmm. I thought, I'm not doing that. So what happened then was, I said, why don't we do something different? We can't have in-person events anymore at that time. Why don't we decide now, you, Anne, this is Anne who ran American Telemedicine Association in the States. You're having a conference coming up. Why don't you pick speakers now? Would you like speakers from Africa, India, Australia, Europe? Well, yes. Well, you've got them on the call. We recruited them. And we actually, between us, created a video, which had a go around the world in 80 minutes, was called. And as a result, people were suddenly going, they didn't know that was what happened in Africa or India or Europe. And then that eventually evolved into a true partnership. That evolved into us creating ecosystems in Africa, in India, and all the other places, and in North America. And as a result, you've then plugged everyone together, connected them. And then what happens is things like health, for example, who are a great partner. They had Las Vegas. We brought lots of people to Las Vegas the last 4 or 5 years, created our own destination on the show floor called a village, the Global Health Connector Village. We brought people from Finland, Norway, Canada, Ireland, UK, all in one place. So American delegates could, without leaving America, go on a tour of the world. And they walked around and went, this is fantastic. So the people in the village started to do business together, but now they had access to the US market. So it evolved rather than a plan. I'd love to tell you I had a vision, and I didn't, because I sleep so well, I don't have vision. But when you find good people and you get them in a room, first thing you do is lock the door. Don't let them out. If they're there for an hour, then what happens? They've got to make a decision. Decision has to be action, and then you start working. And then it becomes almost like, oh, forget about all this collaboration. We'll just do collaboration. So that's how it evolved. It evolved rather than planned.
What are the qualities of an effective participant in these conversations versus ineffective?
Yeah, that's a very good, I should use your terminology, because I call people who are ineffective takers. Okay. They take everything for free. They give nothing back, and we just don't work with them anymore.
Do you assess, or how do you screen for that? Or do they naturally fall out?
No, I think what happens is you meet them first and they're full of all the joys, and I do this and I do that, and I can bring this and I can bring that. So you set a test, and most of them fail almost instantly. And then what happens is you need people also who are willing to work with you for no immediate revenue at the beginning. So you need to get people to prove themselves, not just to us, but us to prove ourselves to them. It's very much a mutual thing. It's amazing how quickly you assess, you make a decision. You may be wrong sometimes, but largely you're right. And you say to someone, for example, this happened. In India, I said to our partner there, who do you know in Africa? And he said, oh, speak to Dr. Amit Thakur. Okay, why do you know him? He said, I've known him for years. So you get a recommendation. I called Amit and said, Raj just told me to speak to you. He said, oh, he's told me all about you. And literally within 30 minutes, we'd agreed a partnership. Amit now sits on our partnership council, as does Raj, as does other people. So it's a human part of it. Yeah. You cannot do this, through technology. You've got to do it. And I do a lot of things in person, at least in the beginning. And then it's like a Zoom call. It's wonderful when you meet people who you've been on Zoom with. Sometimes you don't recognize them. Yeah. You only see them here up. So I think it's taken 15 years to do this. It's hard work, but I find it fun and I just enjoy it. Okay, so the way we operate is we've got 90 ecosystems with lots of what we call connector partners who pay us a fee to join. There's then strategic partners, the very large companies who say, we're interested in these 5 countries. Can you help us enter those countries? There might be a pharma, there might be a data company. It doesn't matter. It almost doesn't matter. We then go to our ecosystem and say, this organization wants to find a partner or a buyer or whatever it may be, or a licensee. And we identify those very specifically and bring them to them. So the technology that they have, we then look at that and try to assess it ourselves and go, that's actually a really smart. And often you find this in really small companies, a startup. Yeah. And I've had 53 startups now in my life, believe it or not. Some were disasters. I'm not going to talk to you about them. Failures, people don't always accept what I say in this. I think failures are just as important as successes, because you can get arrogant if you've nothing but success. I don't know anybody who started every single thing they've ever done has been a success. They'll tell you it is. I will tell you that's not happened to me. So I had lots of failures. I learned more from the failures, actually, than from the successes. I made more money from the successes, but in terms of understanding how to do things, more from the failures. So you shouldn't be ashamed of saying that didn't work. Why did it not work? Don't make the same mistakes again. Make new ones, but don't make the same ones. So I think technology-wise, we often take a technology from a startup or even a large company and take it to other countries. And we're able to do that because we've got a permanent network. And we just simply say to Adriana, who runs our 90 ecosystems, and goes, who does this? Let me ask. So they all meet in their own particular region or country. I tell you, we had 200 meetings inside our network in the last 12 months, with 17,000 people attended in person. No one else has got that. Then every 6 weeks or so, we bring all the coordinators together on a Zoom call. Again, limited to 1 hour. And we say to them, right, 2 ecosystems are allowed to present. Tell me about the ecosystem in, for example, Budapest. Tell me the one in Barcelona. Tell me the one in Central Florida. Tell me the one in Nashville. And it is amazing how people are genuinely interested to hear what's happening around the world. And as a result, they say, okay, could you use this technology? And they say, is it FDA approved? Is it CE mark? We can go through all that with them. And often we then get deals done, not with us, so to speak, but facilitated by us between a company here in one country and one over here. Real partnerships are formed, and often joint research projects are formed as well. So it's a sort of we're not constrained. Don't allow ourselves to be constrained. People don't do it like that. Well, I don't care. I want to do it, not just my way, but our way, because a great team, I say, Bran, that won't work. But we have an amazing team who are as dedicated as I am to making real things work.
Oh, I have so many questions. You just mentioned the huge scale that you have on a global level. And earlier you're saying, I don't have a vision. I was just taking this day by day. Do you have a vision for what you want to do with now all of these networks and ecosystems established? What is possible?
Well, I think what's possible is nothing's impossible is the first thing. Genuinely, because I think that we've got to where we've got to, not because we do things haphazardly. We don't. People sometimes think we are, but we're not. We're very measured, very intentional. And because we've learned so much, we're then able to say, okay, the people who are our members, they teach us. We learn a lot from them. They say, example, I just spoke to one at one of the stands, just like literally 10 minutes ago. And I said, what is it you need? Because always ask, what need do you fulfill? Because sometimes startup people have the best, brilliant idea. They're so wedded to it. They think it's the best idea in the world. And I say a couple of questions. Number one, what need are you solving? They look at you and they go, but everybody want to buy it. And I said, no, that's answer the question. Because people sometimes have brilliant ideas, but they're of no commercial use. How many lives are you going to save by doing that? How much are you going to save a company or a workflow plan? How much? If you don't know what the need is, you're never going to solve it. So too many people spend too long being a startup. I know startups been being a startup for 15 years and they're living on grants and eking it out, paying them salaries every month. Whereas I'm saying, why don't you get a customer? Because that's real revenue. And then you have more credibility, which means the value of your company goes up. And then you get investors in it at higher valuation. There you're less diluted. So we've learned over the years, and I think the process is this. We have a 90 plus ecosystem at the moment. We are developing in Africa. We'll probably have 20 or maybe more ecosystems in Africa in the next 6 months. In the US, we have 6 at the moment. I think it's 5 or 6. We have applications from another 15. Why? Not because they think we're geniuses, but they look at this, as you say, the scale, our willingness to make connections literally globally. And people do not want to be trapped in their own country only. They may want to operate in their own country only, but they know there are innovations in other countries which should be applied to, and the people I've just been speaking to said, we need 3 things to solve that problem. Can you find them for us in Europe? So our team are going to go and research, find them, and then make the connection. And everybody wants to know what's happening elsewhere. And I'm not sure I'm not sure there is a limit to what we can do. I'm not arrogant enough to think there is no limit. But I think, convinced and confident with the team we have got and the members, because that's our community, we will continue to grow at a rapid rate. Not because we want to grow at a rapid rate, but because by growing, you're opening up new opportunities for everyone around the world.
What are some specific use cases or companies that you helped facilitate and make those connections that have completely changed the course of their business, or
Yes.
even at the government level?
Correct.
Yeah.
So give you a couple of examples. Some I can't disclose because of NDAs, but to give you examples. When we started working in Africa, people say, "What does Africa need?" Most people around the world, unfortunately, don't know Africa, so they look at Africa and say, "Well, that's full of famine, full of pandemics, it's full of wars," and you go, it's corrupt. And I smile to myself and I look at the countries in the developed world as they arrogantly call ourselves. And I think it is arrogant to call ourselves that. Because remember, they were called the Global South, and I hate those expressions. So when I went to Africa first, I wanted to learn myself. I went personally, and I was taken aback. If people understood what's actually happening in Africa, as opposed to what they think, because many won't even look deeper than the headlines. What we discovered, for example, with the Africa CDC, we work with them. We run a huge project for them. And through that, we created a thing called the Africa Digital Health Networks to do exactly what we have done in the rest of the world. So that's evolving and developing fast. We then plug that into the global network. So suddenly African organizations, again, same model, are saying, hold on, can you tell me what's happening in Massachusetts or in Birmingham in the UK or wherever? So of course, so now we have lots of stuff going on between the countries. One of the ones I'll tell you about was there's a fantastic innovation in Africa, born out of no money. So this particular innovation was a handheld ultrasound. Why did it happen? Because the lady who invented it, ultrasound had been around for a long time. She got it reduced in size to holding your hand, literally. She lived in a village in Rwanda, right? It's 4 hours from many of the main places. So she went, I cannot have a pregnant mother walking 4 hours to see a doctor and 4 hours back. Is there any surprise there's so many deaths? So the Rwandan government, along with the Gates Foundation and many others, connected the dots. First, we need telephone, mobile coverage across the whole of Uganda. The only way we're going to do it in Rwanda is if you get a license to cover that part of the country, you must also put a mast in every village. That's your telephone stuff. That gives you the connectivity, but there's no use to it if there's no electricity in the village. So the trickle-down electricity from the mast, which is stuck into the ground and is wasted, suddenly became connected to a fridge, which Bill Gates put in every village. You think, why a fridge? But it also connected to an iPad, which became the clinic in the village. Then this lady went, okay, I can do an ultrasound. I can now send the ultrasound to the doctor 4 hours away. He can look at it. The mother goes up to this little clinic, has blood pressure and so on, right? Takes all that, and the doctor goes, I've looked at your scan. You're fine, but I need to change your medication. I'll send you new medication. Now, they're 4 hours away. There's no roads. I'll send it by drone. This 5 years ago, this is. So it arrives in, parachutes the medication down. The village chief picks it up. Only one allowed to pick it up, takes out those that need to be in the fridge, puts it in the fridge. The next morning, the mother's come along and taking a medication. He knows them all. This nurse, for $1,000, I think it was, created this handheld ultrasound. To compare notes, 5 million euros to develop the same thing in Europe, close to $8 million US in the States. She said, well, all I need is $1,000. So she has spread that through all the villages across Rwanda and is now doing much more. So we take an invention like that and go, this is good. This is getting to real people. It is saving lives and improving lives. So why wouldn't we tell the rest of our ecosystems about that? So that's an example where frugal innovation, as they brilliantly call it in Africa, frugal innovation has a place in the developed world. And we should not be so arrogant to think that we're the only ones who can invent things.
I'm curious, from all the founders that you're seeing around, what advice do you have for them, given this example that you just gave me?
Well, the fundamental advice is always, they tell me about all their software, and some of them are, I'm used to this technology. I have to learn that. When a computer goes wrong, I switch it off and switch it on. I hope it works. And if it doesn't work, I call one of my grandsons who said, I use your hot desk, and he helps me. First question is, what does your software do to save lives or improve lives? What does it do? If they can answer that question truthfully and honestly, okay, how much does it cost? Because it may be above the level that people in LMIC countries can afford. And maybe you go for a different market who don't mind paying that sort of money. Then you say, okay, but it's got to be part of a supply chain because nobody's got a solution that covers everything. Some people think they have. I disabuse them of that notion and I say, you're mad. Why did I get you a partner in the country who already, for example, has a network which delivers lots of services. Why don't you become an API or a product or whatever it is, and I'll deliver it for you? Are you going to go and set up a supply chain in Nairobi? Well, you can if you want, but your lifetime's gone. So why wouldn't you take what's on the ground? The reason you do that is you don't know what's on the ground, and you assume there's nothing on the ground.
Or you assume my way is the better way, therefore I'm going to impose my standards on whatever exists, but that's not going to be adopted.
Correct.
That's fascinating. Is there anything that I haven't asked that you would like to share with our listeners?
Well, I think that, just to say, I just love what I do because I love to help people. I can't do it for nothing. The organization needs money to pay for our team. But I find once you weeded out the takers, it doesn't take long to actually do some things which give you huge personal satisfaction. Not because you have done it, but you've facilitated them in some country around the world. And I think there's so many good people in the world. And sometimes you forget that in today's situation. There's good people who are doing good things and want to do more good things. And if I can facilitate them through Global Health Connector in any way, that's what I do.
It's fantastic. Thank you so much for your time.
My pleasure.
Thank you for joining us for this episode of the Akros Advantage. Healthcare is one of the most complex industries in the world, and every conversation in this series explores a different piece of that puzzle, from innovation and patient experience to commercialization, investment, and systems transformation. A special thank you to our guests for sharing their expertise, experience, and insights with us. If you enjoyed this conversation, be sure to subscribe, follow along, and explore additional resources from Akros Advisory, including our newsletter, where we help healthcare innovators navigate the path from idea to impact. Until next time, keep asking better questions, challenging assumptions, and building solutions that create meaningful value for the people they serve. I'm Demi Radeva, and this has been the Akros Advantage.